Hello friends, how are you all doing? In this video, I'm going to classify peripherally acting muscle relaxants. And if you like this video, please subscribe to my channel. Before going to classifying peripherally acting muscle relaxants, a word on centrally acting muscle relaxants. These act specifically at cortex and brain, spinal cord level. Examples are baclofen, methocarbamol, and tizanidine. Coming to peripherally acting muscle relaxants, we have two broad categories. One is the directly acting muscle relaxant that acts directly on the muscle level, at the muscle level, and the other are neuromuscular blocking agents, which act at the neuromuscular junction, specifically on the acetylcholine receptor. Coming to examples of directly acting muscle relaxants, they are dantrolene sodium and quinine. And dantrolene sodium is in use, and it's specifically used as antidote for certain conditions like malignant hyperpyrexia, which is an iatrogenic entity caused by patients' exposure to succinylcholine and inhalational agents, examples being isoflurane or sevoflurane. And this medication comes in a yellowish powder form, and it's very difficult to dilute this. And there are situations where in crisis where we treat situations like malignant hyperpyrexia, we may need a person dedicated for diluting dantrolene sodium. Uh, there are situations where the dantrolene sodium powder is taken out and put in a container and mixed physically and then drawn into syringes. Quinine is not in use, and it's not FDA approved as well. Coming to neuromuscular blocking agents, we have depolarizing and non-depolarizing. The depolarizing agents they have agonistic action at the acetylcholine receptor, and the examples are succinylcholine and decamethonium. Succinylcholine is a diacetylcholine, which means two acetylcholines molecules are attached to each other, and it's frequently used in a situation called rapid sequence intubation, where patients' airway is to be secured in a quick way. The onset of action is about 45 seconds to 1 minute, and succinylcholine has its own set of complications that needs to be kept in mind. I have a mnemonic here, CHAMP. C stands for cardiovascular complications. It can be bradyarrhythmia, tachyarrhythmia. Uh, uh, H stands for hyperkalemia, A for anaphylaxis, M for muscle-related complications. I've just mentioned malignant hyperpyrexia. It could be myalgia. It could be even deep block, also called as phase 2 block, and it can be fasciculations as well. P is for pressures. It can increase intracranial pressure, intraocular pressure, and intra-abdominal pressure. The other drug, decamethonium, is not in use. Among the non-depolarizing muscle relaxants, they are divided into three categories based on the duration of action. Short acting, 10 to 20 minutes. Intermediate acting, 20 to 50 minutes. Long acting, more than 50 minutes. Short acting non-depolarizing muscle relaxants, example is mevacurium. And the specification about mevacurium is that it behaves a bit differently from other non-depolarizing muscle relaxants. And usually non-depolarizing muscle relaxants needs a reversal with the acetylcholine building agent, namely neostigmine. Whereas mevacurium should not be reversed because it's metabolized in the plasma by pseudocholinesterase, the enzyme that actually metabolizes succinylcholine as well. So that's the specific point about mevacurium. Coming to non-depolarizing intermediate acting medications, we have atracurium, cisatracurium, vecuronium, rocuronium, and rapacuronium. A few points about atracurium. It is the most commonly used non-depolarizing muscle relaxant in the current practice. Its peculiarity is that the metabolism is non-organ dependent. It has a metabolism phenomenon called Hoffman degradation, wherein this is non-organ dependent, and there is an end product called laudanosine. The other type of metabolism is by the plasma esterases. Cisatracurium is an isomer and has similar activity and metabolism also takes place through ester hydrolysis and Hoffman degradation. Vecuronium, rocuronium are in use, of which rocuronium is more commonly in use, and it can be a replacement for suxamethonium in rapid sequence intubation in situations where suxamethonium is contraindicated. The other rapacuronium is not in use in current practice. Coming to non-depolarizing long-acting duration medications for more than 50 minutes, we have D-tubocurarine, doxacurium, metocurine, pancuronium, pipecuronium, allcuronium, and galamine. Of these drugs, only pancuronium is in use, albeit less frequently, is used in situations where duration of action can be allowed to be long, for example, in cardiothoracic surgeries. And if you have noticed in this classification, I have underlined a few of these drugs, and I would mean, and I have mentioned at the bottom, that underlined drugs are the ones that are used currently. And the neuromuscular blockers that are non-depolarizing can actually be classified in another way based on the chemical structure. And I have also indirectly classified them in this video. The ones that are shown in bold are the steroidal compounds, and the ones that are shown in italics are the benzyl isoquinoline compounds. The peculiarities of steroidal compounds is that they have a bit of autonomic action, and the so-called autonomic margin of safety is narrow for drugs like pancuronium, and it's a bit more wider for drugs like rocuronium or vecuronium. The italic mentioned medications, the benzyl isoquinoline compounds, are, for example, etracurium and cisatracurium. They can release histamine, and that is the side effect of benzyl isoquinoline compounds. And histamine release can actually cause even anaphylaxis or anaphylactoid reactions. That's in brief about peripherally acting muscle relaxants. At the end of this, I would again go through the classification for your easy remembrance and revision. Peripherally acting muscle relaxants broadly divided into directly acting, neuromuscular level blocking agents. Directly acting examples are dantrolene sodium, quinine. Neuromuscular blockers, depolarizing examples are suxamethonium, decamethonium. Non-depolarizing short-acting, mivacurium. Non-depolarizing intermediate-acting, etracurium, cisatracurium, vecuronium, rocuronium, rapacuronium. Non-depolarizing long-acting, D-tubocurarine, doxacurium, metocurine, pancuronium, pipecuronium, alcuronium, and galamine. That's about it, folks. If you like the video, please subscribe and support me. Thank you. Happy learning.